Look what it did.
It moved!
No, it didn't move. That's what happened on the video. Let's try my phone.
Well, what about that? There.
Is it recording?
Yes. I'll just cut this part out. I mean, it looks a little blurry, but... I'm gonna leave that in. I'm gonna cut it all out and be like,
Should we leave it like
bloopers?
Should we leave it like that then? Is that fine?
I think so. I think we're good.
Okay. Yep, lay down.
Yes.
Knock, knock. Hello, Mrs. Schutz. Pull the curtain for privacy and hygiene. Oh, jeez. All right, can you confirm your name and your birthday for me, please?
Jolene Schutz, 7/18/1997.
Okay, can I see your band? Thank you. All right, so what we're gonna do today is we're gonna move you into your chair, okay? Get you moving around a little bit.
Okay.
All right, so I know physical therapy was here yesterday and they taught you how to work with the cane. Do you need a little bit more help with that?
Yeah.
Yeah? Okay. So your left side is your weak side, correct?
Yeah.
All right, so what we're gonna do is you wanna push the cane a little bit in front of you, step with your weak, and then your strong. And so you wanna step into the walker, okay?
Okay.
And then when you pivot, we wanna pivot on your strong side, so your right side. So you wanna move to your right,
Okay.
okay?
Yeah.
All right, so we wanna make sure that the wheels on the bed are locked. We want to move the mat prior to dangling the patient. We also want to make sure that the bed alarm is off. And we also want to just always check the IV, make sure there's no kinks or make sure it's working. And then we also want to make sure, before even moving the patient, we also want to make sure that the wheels are locked on the wheelchair. All right, so we're going to set you up. I'm going to set her up a little bit. It'll be easier for her to move. Make sure the IV is good. And we also want to put on gripper socks before dangling them so that they have a little bit of traction.
Ooh, these are comfy.
Are they? All right.
I got unicorns on my toes.
All right, I'm gonna swing your legs over, and if you want to, with your strong side, grab here, which can help you lift yourself. Ready? 1, 2, and 3. All right, you okay?
Yes.
All right. Go ahead and put the gait belt on you. Make sure you got it the right way. All right, reach around. We also want to make sure that there are no like kinks in the gait belt. We also want to make sure that it's pretty tight, only 2 finger widths. Sorry.
It's all good. I don't want to fall.
Well, neither do I. I don't want you to fall. All right. So now what we're going to do is I'm going to put my feet in front of yours. And I want you to reach up and hold my shoulders. And we're going to rock you, and on the count of 3, I want you to stand up, okay?
Okay.
All right. 1, 2, and 3. You can also tighten this a little bit if it tends to come loose. I want to stand on her weak side. All right, let me get this green. All right, you doing okay? You're not dizzy or anything?
Yeah, I'm good.
All right, you ready? We're gonna do your weak and then your strong, right? Okay, let's push the cane or the walker. Weak, strong. All right, now we want to pivot to your right a little bit. There you go. Then we're gonna wind that around there. Okay, let's move forward a little bit more. Okay, now we want to pivot. And pivot again. Pivot again. All right, let's move back a little bit. Okay, can you feel the chair?
Yeah.
Okay, I want you to reach back on the handles and seat yourself down. There you go. How you doing?
Good.
You okay?
Yep.
All right, so now that she is seated, we want to make sure that the IV is still intact and isn't kinked. We also can take the gait belt off if they're going to be in the chair for a little while because it could be tight or restricting. Of course, we want to make sure still that the brakes are on, and I'm going to give her the call light on her strong side. All right, Mrs. Schutz, call me if you need it, or bring the call light if you need anything, okay?
Sounds good.
What are you going to do if you need me?
Call the call light. Pull the call light.
Okay. All right, do you want the privacy curtain closed or open?
It can be open.
It can be open? Okay. So then I can open it, hand hygiene. And we also want to let the patient know that she might want to just shift her weight a little bit while she's sitting in the chair. And then come back in, knock, knock, knock. Pull the privacy curtain. How you doing?
Good.
Good?
Yeah.
Hand hygiene. All right, we're going to get you back up into bed. Is that okay?
Yeah.
Perfect. All right. We also, again, just want to verify that the wheels are locked. And then if you want to, I'm going to grab onto the gait belt. We're going to rock, and then I want you to push up with your hands on the count of 3. Ready? 1, 2, 3. Okay. There's that. Again, wanting to make sure that we are standing on the weak side. Okay. All right, let's pivot a little bit towards the right. Okay. Weak, strong. Weak, strong. All right, let's pivot towards the right. Now let's back up a little bit until you can feel the bed. Can you feel the bed?
Yeah.
All right, on the count of 3, we're gonna sit. Ready? 1, 2, 3. How are you doing?
Good.
Not dizzy or weak or anything?
No.
Okay. Take this away from you. Take the gait belt off. Alright. Now we're going to go ahead and lay you back. I'm just going to lay you down. There you go. Now again, we want to make sure that the IV isn't kinked. It's all good. We want to turn the bed alarm on. We want to make sure, again, that the wheels are locked and get the mat out. All right, Mrs. Schutz, are you comfortable, or would you like your head laid back a little bit?
I'm good.
You're good?
Yep.
All right, so we'll give her the call light on her strong side. Call me if you need me, okay?
Sounds good.
What are you going to do if you need me?
Call you.
Okay. Now we'll want to declutter the room. And we can leave the gripper socks on if they want to. It's probably best if we do leave them on. And then, like I said, declutter the room. Hand hygiene again. All right, we'll see you later, okay?
Bye.
Alicia!
I think we're good. We'll just chop it
Yeah.
up. Or we'll leave it and they'll laugh at us.
Yeah. Okay. I'm like thinking, did I get everything? Did I? Okay.
I think so. Where's that? It's not too dirty.
No.
Alright, so I'm going to do my ambulation video now. I'm gonna knock. Hello, Miss Felicia.
Hello.
I am Jolyn, and I will be your student nurse today. We are going to get you up and ambulating. We're going to put you in a chair, kind of change positions a little bit for today.
Okay.
First, can I have you verify your name and your birthday?
Felicia Zaber, 6'2",
All right. And to my memory, physical therapy was in here yesterday and taught you how to walk with your cane. Do you remember that, or would you like a quick refresher?
Quick refresher, please.
All right. So when we stand up, you're going to hang on with both hands, and I'm going to be standing on your weak side, and that's your left side, correct?
Correct.
All right. So when we walk, we're going to push the walker forward. Then we're going to walk with your weak foot first,
Okay.
and then you're strong. And we're always going to walk into the walker, all right?
Okay.
So I'm going to turn off the bed alarm. That way we don't have it sounding off. I'm going to move the pad, and at the same time I'm going to double check to make sure that the wheels are locked. I am going to apply her gripper socks. That way she doesn't slip as we walk towards the chair. So what I'm going to have you do is we're going to sit up, and I'm going to dangle your feet over just to kind of even out your balance and your blood pressure if you feel dizzy, all right?
Okay.
Okay. If you want, you can use your right hand and hang on to the side rail and pull yourself up as I swing your legs out of the bed.
Okay.
All right. I'm going to grab the gait belt. And as I'm unrolling it, I can ask, are you feeling any dizziness, any pain, or fatigue anywhere?
Nope.
All right. So I'm going to place the gait belt around her. And I want to make sure that there's no twists or anything, as that can be uncomfortable and it can cause some skin breakdown if on for too long. I'm going to make sure that the gait belt is on tight enough, so 2 fingers width tight. And I'm going to leave a little bit of a loop because typically when they stand up, the gait belt will loosen a little bit. I'm going to reposition that so it's easier for me to grab after she stands up. All right, I'm going to stand toe to toe, and we are going to rock. And on the count of 3, we're going to stand up, and I would like for you to hold on to my shoulders. Is that all right?
Okay.
All right. Ready?
Yep.
1, 2, 3. All right. I'm going to hand you your walker. You're not feeling dizzy or fatigued or anything?
Nope.
All right. I'm going to move the IV pole here quick. And I always want to make sure that you're standing on her weak side so you can be the strong for her. All right. We're going to take a step forward. So push your walker, your weak, and your strong. All right. We're going to pivot on your strong side. We're going to pivot to the right.
Okay.
A little bit more.
Okay.
All right. If you want to walk forward one more time, so push, weak, and strong. Pivot one more time. All right, if you would like to back up. Can you feel the chair behind your legs?
Yep.
Okay. I'm going to have you reach back with your arms to feel the armrests.
Okay.
And go ahead and sit down. All right. And how are you feeling after that walk?
Good.
All right. So I'm going to move the walker out of her way, and if I were to leave the room, I'm going to make sure and double check that I have the wheels on the wheelchair locked. I'm going to make sure that she has her call light, so if she needs anything, she can call me. I'm going to double check again just to make sure that she's feeling okay. Are you feeling okay, Miss Saber?
Yeah.
All right. And would you like the privacy curtain pulled, or would you bind that back?
You can pull it. That's fine.
All right. And then I'm going to walk out after I've given her those things. And I'm going to also remind her that while she's sitting in the chair to kind of shift her weight a little bit. That way we don't create any skin breakdown or ulcers. All right, Miss Sabra, I'm going to be back when you, in a little bit, or if you need me sooner, go ahead and call the call light, all right?
Okay.
All right. So on my way back, I'm gonna knock. Hello, Miss Sabra, and do hand hygiene.
Hello.
How has it been sitting in your chair?
Great.
Great. All right, are you ready to get back in your bed?
Yes, I am.
Okay.
I'm tired.
I would be too. It's kind of a lot of work being in the hospital and walking when you're tired like that.
Mm-hmm.
All right. Do you want a quick refresher of how to walk?
No, I remember.
All right. So this time, I'm going to stand in front of you toe to toe.
Okay.
But I'm going to have you push up on the arms of the chair this time, okay?
Okay.
All right. And so I'm going to rock, and on the count of 3, we're going to stand.
Okay.
1, 2, 3. All right. And here's your walker. I'm going to move the IV forward quick. All right, if you would like to take a step forward, so your walker, your weak side, and your strong. We're going to pivot a little bit on your strong side. And step forward one more time. And pivot. All right, and go ahead and walk back.
Okay.
Can you feel the bed behind your knees?
Yep.
All right, go ahead and sit down. I'm going to move the walker out of the way.
Whoa.
I'm going to take the gait belt off. Are you feeling okay? No dizziness or fatigue or any pain?
Nope, I'm okay.
All right. Going to roll the gait belt back up. All right, we're going to go ahead and swing your legs back in and lay you down, okay?
Okay.
All right, and I want to double check to make sure that we didn't kink or lay down on the IV tubing as we laid her back. I'm going to turn the the bed alarm back on, and I'm going to get the pads on the floor back out. That way, if she happens to roll out of bed, there's a soft landing. Double check to make sure that the wheels are locked. Give her call light on her strong side, and make sure the bed is in the lowest position. Are you comfortable that way, or would you like to lay back a little bit more?
I'm okay.
All right. And if you need anything, please pull the call light for me.
Okay.
All right. And as I walk out, I'm going to pull the privacy curtain. Make sure that I take the gait belt out because it's not anything she needs in her room to keep it cluttered. And I'm going to perform hand hygiene. Ta-da. Done. I feel like I missed something in there.